Okay, so I think that's a good transition into one of our first community questions.
Mhm.
And then I'm going to repeat what you said because I think there's a common misconception that there is a germline genetic link to most breast cancers, right? And it's really just the opposite because you said
Right.
only 5 to 10. So if you are a woman, maybe you haven't been, or man, and you haven't been diagnosed with breast cancer yet, but there is some family history. What factors determine eligibility for genetic testing in breast cancer?
Yeah. So the first thing to note is that it is most useful to conduct germline testing in someone who has cancer.
Okay.
Okay, that's number one.
Okay.
Um, that is the most useful scenario. So for this, for what you're doing and who I assume is listening, that these are breast cancer patients or survivors, it is most important for people who have cancer to get germline testing. Now, does that mean that there are not certain family history characteristics where if you don't have cancer, you haven't gotten it, that you should get tested? Yeah, there are, but it's always um, more useful, if you will, in catching a genetic mutation by testing someone who actually has cancer. Um, Now, with that being said, what constitutes a strong family history in general? So that gets thrown around a lot too, right? Of like, I have something in my family. And I told you off camera before we started, I'm Southern, so we talk about this a lot. Your first cousin, second cousin, third cousin, twice removed, and like, how deep do you have to go with everything, right? So if in your family there is a history of young breast cancer, meaning someone had breast cancer under the age of 50, in your close family means first, second, or third degree relatives. Okay, so we're talking about like mom, dad, sister, brother, children, nieces, nephews, great grandparents, first cousins. Once, like me, you start to get to the second and third cousin, we're not talking about those so much, but you're close, kind of your first, second, or third degree relative. So if there's young breast cancer under the age of 50, if there's male breast cancer, so men with breast cancer, in one of those relatives. If you have someone with pancreatic cancer, ovarian cancer, or certain forms of prostate cancer in a close relative, that's also sort of another risk factor. Beyond that, if you have one side of your family, like if you're thinking about it, there's one side of your family that has three or more cancers, that's also
Mhm.
something to consider. Now, with that being said, when you have a breast cancer diagnosis, so again, for the people who are here, who have a breast cancer diagnosis, I assume, then the question of when to do germline testing is much broader. Okay, so in that instance, all of the family history questions still apply, but also if someone is under the age of 50, anyone with triple negative breast cancer would be offered germline testing. There are certain clinical scenarios where germline testing is important for treatment decisions. There are certain ethnic groups, so Ashkenazi Jewish families. There's a founder's mutation that has been identified in those families that lead to a higher risk of breast cancer. So that would be another indication as well. The other important point for patients who are diagnosed with breast cancer is if there's a lobular breast cancer and a history of stomach cancer, an entity called diffuse gastric cancer, that would be another indication for genetic testing. So it is complicated.
Yes. It is complicated to know those different avenues and when you should be advocating for yourself if you have not just
Yes.
naturally been offered it um, through one of your doctors, which does unfortunately happen all the time, depending on where you're receiving your care. So it sounds like because there are so many avenues. It's best just to understand that this line of testing exists, it's important, and that you should just bring it up and have a conversation with your
Yeah,
doctor.
absolutely. It doesn't hurt to ask,
Right.
when you're diagnosed, do I need germline testing? If you can't remember germline, do I need testing for a family history? Do I need genetic testing for hereditary cancer? Is that